I, John Perishaw, voluntarily give Maryville University permission to record my image and voice and grant Maryville University all rights to use this recording in any medium for educational and other purposes that support the mission of Maryville University. I understand that the following information will be gathered by a Maryville University student as part of a course assignment. I give my express consent for this information gathering and physical assessment to be filmed and posted in the student's course shell for access by the faculty and student at Maryville University. I further acknowledge that since the recording is for educational purposes only and the information is not meant to be diagnostic, therefore Maryville University faculty, staff, and students are not considered liable. The recording will be deleted by the student in any of their devices as soon as it has been reviewed and graded by the instructor.
Hi, my name is Erica. I'm going to be your nurse practitioner today, and I'm going to do your ear, eyes, nose, and throat assessment. Could you please state your name and date of birth?
My name is John Perishaw, date of birth 12/07/72.
Okay, and we've provided privacy. So we're going to start off by just examining your head. Its contours are normal, it's symmetrical. I don't see any, is any of this tender?
No.
I don't feel any masses or depressions. And then your face is symmetrical, and can you smile to test central nerve 7? It's symmetrical. I don't see any lesions, no swelling, no redness. Your eyes, your eyelids, your palpebral fissure, your eyebrows, and your eyelashes are all symmetrical, and there's no redness or drainage or swelling. And then I'm going to look in your conjunctiva, which are pink and appropriately vasculated. Your sclera is white. Your lacrimal ducts, there's no drainage, they're not red or swollen. Your cornea and lens are both round and regular. Your cornea and your pupil are round and regular, and your lens is clear. Your pupil is about 3 millimeters. And I'm going to do the Snellen test for you. This is to test cranial nerve 2, which is your central visual acuity. And this is a modified form, so I'm going to stand back 6 feet. And if you could cover one eye and read the smallest letters.
LTFPH.
And then cover the other eye.
LTFPH.
Great. And now what I'm going to do is I'm going to test for your pupil dilation. So constriction in your right eye that I've shown in is direct. Consensual constriction is found in your right eye. Direct and consensual. Great. Now I'm going to test for accommodation. Just watch my pen as I bring it to your nose. Your pupils constrict as I bring it into your nose. Okay, and now I'm going to do a confrontation test. So what you're going to do is cover this eye, and then tell me when my fingers are moving.
No. No.
Okay, now cover the other eye.
No.
Okay, good. Now I'm going to do the I'm going to do your ocular motor movement, testing your cranial nerves 3, 4, and 6. Follow the pen with just your eyes. And then convergence, I'm going to bring this in, and your eyes should converge on the pen. Good. There was no nystagmus noted while moving that, and there was also no lid lag in your movement. Now I'm going to look deep into your eyes with my ophthalmoscope. I'm gonna start out with -1 because you have myopia. And I'm gonna start out by looking for your red reflex, which I found. Now I can see your retina and the vascular on your eye, your retina, and your optic disc. Great. I found your red reflex. Great, thank you. Now I'm gonna go to your ears. Your ears are, their auricles are symmetrical and in line with your eye. I see no, they're symmetrical, no lesions or deformities. And are they tender? Okay, so now I'm gonna look into your ear canal, looking for any redness, inflammation, or foreign objects. Okay, and now I'm going to look into your canal. I'm gonna pull your ear, I'm gonna pull your ear up and back. I can see your tympanic membrane is, pearly gray. And your malleus and your hammer, and there's no exudate or drainage, no inflammation or lesions. And there's no foreign bodies. You can see your tympanic membrane. Okay. Now I'm going to do your hearing test. We're gonna do a Weber's test. Tell me if you hear this in one ear better, or is it both the same?
Both.
And then tell me when you stop hearing this. This is the Renee test.
No.
Can you tell me when you stop hearing this?
No.
That's testing your air conduction and bone conduction, which should be 2 to 1, with air being longer than, twice as long as your bone conduction. Now I'm gonna do a whisper test. This is testing your cranial nerve number 8. Cover one ear and repeat the word after me. And then cover the other ear and repeat after me. Great. Now I'm going to test your nose. And upon an inspection, there's no deformities or lesions. And then on palpate, no obstructions. And then if you'll tilt your head back, I'm gonna look in your nose. It is pink. It is pink and no drainage, nodules, or inflammation. Also, your septum is not deviated or perforated or inflamed. On this side, same thing. Okay. Okay, this is going to be testing your cranial nerve 1, olfactory. Smell that and tell me what you smell.
Baby powder.
Okay. And something else with the nose I'm forgetting. Shoot. Oh, so I'm going to test your sinus, your frontal sinuses and your maxillary sinuses. Are those tender? Okay, great. Okay, now I'm going to look at your mouth. Your lips are moist, appropriate color. There's no cracking, no lesions, no deformities. And then if you will open your mouth, I'm going to look at your the back of your mouth, there's your uvula, your anterior and posterior pillars. I cannot see your tonsils. It's pink, no exudate, no masses or lesions. Your gums are pink, oops, no lesions. Your teeth are appropriately spaced, there's no loose teeth. Okay, and then your tongue is appropriate color and texture. Underneath your tongue, see the veins, and there's no lesions, masses, or deformities. And then we're gonna go to neck. So neck, I'm gonna look at your neck. Your trachea looks like it's not deviated. It feels in line. No deformities or masses. Now I'm gonna check your thyroid. And palpating that, I feel no lesions. It's soft and spongy. I'll test the other side. Okay, and then if you'll swallow for me, there's appropriate movement of your thyroid. And then I'm going to palpate your lymph nodes, your pre-auricle, your post-auricle, your occipital, your superficial clavicle, your deep clavicle, your posterior, not clavicle, cervical, both of those, superficial cervical, deep cervical, posterior cervical, and then your supraclavicular. Then your tonsillar, submandibular, and submental. That's it. And that concludes this assessment.